Okay. Dear students, you are welcome to yet this another session. I'm Kiden Robina and I'll be taking you through this. So today we are going to look at components of labor and the fetal assessment. So by the end of this session, you should be able to describe the components of labor. So components of labor include the following. We have the passageway, passenger, power, and cycle. So let's start with the passageway. So when we talk about the passageway, here we are referring to basically the pelvis, because this is where the fetus passes until is born. So when we are talking about the pelvis, we consider the normal pelvis and the abnormal pelvis. The abnormal pelvis are the other types of pelvis that are considered not to be female pelvis. Then the normal one is the gynecoid pelvis, which is considered to be the female pelvis. So right there, we are looking at the pelvis and the pelvic measurements. And in the normal gynecoid pelvis, we have the diagonal conjugate, which measures 12.5 centimeters. Then we have the transverse diameter of the outlet, which measures 13.5 centimeters. Then we have the R and L oblique diameter, which measures 12.75 centimeters. So right there we have an image which shows the pelvis. So here these are the major measurements on the pelvis as seen here. So these measurements here shows us the measurements at the inlet when the head is engaging or any presenting part that is engaging. Then we have the pelvic cavity, within the cavity, then the pelvic outlet. So still that is talking about uh, the different diameters. So let us look at the cervix. Cervix is part of the passageway. So when we talk about the cervix, one determinant is the shortening and thinning of the cervical canal, which is effacement. So during labor, the effacement of the cervix takes place. The cervix is taken up. Becomes thin. It thins out. So as it is taken up, it becomes thin and it is measured in centimeters. So this is one of the important components that we assess for during labor. Then dilation. Dilation, this is the increase in the cervical diameter. So the cervical os opens in and it increases in diameter. So this measurement also is one important component of labor. Let us look at passenger, which is the fetus. So here the major determinant is the head, and when we are looking at this, the larger the head is the largest part of the fetus. So during delivery, if the head passes through the cervix, then it means that the rest of the body will be able to pass through. So when a newborn is born, you can see that the head is looking bigger than the other parts of the body. So here we are looking at the diameters. We have the biparietal diameter, which measures from one side of the parietal eminence to another side of the parietal eminence. So in between is the parietal diameter, and it measures 9.5 centimeters. Then we have the occipital frontal diameter, which measures from the middle of from the frontal part of the head up to the occiput. Then we have the mental pragmatic measuring 9.5. Then we have the supra occipital mental, which is measuring 13.5. Then the sub occipital pragmatic 9.5. So when the head is engaging in the vertex uh, position or vertex presentation. Then the head, the head is engaging with this diameter, which is 9.5. And you remember we had talked about the the diagonal diameter being 12, or the diameter that runs diagonally being 12 centimeters. So that means that the 9.5 centimeters can be able to uh, engage without any problem, because it is smaller than the 12 centimeters. Then let us look at the fetal skull characteristics. The fetal skull is a dynamic structure. So at the time when the fetus is growing, there are sutures. Sutures, these are membranous openings in the fetal skull, and these normally allow for the molding of the head to take place. So these are very, very important. So the sutures, we have the frontal suture, sagittal suture, coronal, lambdoidal, and they really play very, very important, as we have seen here. So right here we have the anterior suture. This is the frontal suture, the coronal suture, the anterior suture. Then the lambdoidal suture is the one that is here at the back of the head. So these membranous openings allow for brain development uh, and the growth. Then they also facilitate molding to make sure that the head becomes smaller as it passes through the cervix. Then they provide valuable information about the baby's health and the position. So they are also shown right here. We have already looked at that. So in addition to that, we also have what is called the fontanelles. There are two fontanelles. We have the anterior and the posterior. So the anterior fontanelle is diamond shaped. Then the posterior is triangular shaped. So when doing vaginal examination and you touch a membranous area which is diamond shaped, it means that is the anterior fontanelle, and it normally happens in brow presentation, which is very difficult to be delivered, cannot be delivered actually. Then if you check and you get a triangular shape, that means that it is posterior, and that signifies the vertex presentation, which is a very ideal kind of presentation for childbirth, vaginal childbirth. Let us look at the passenger. We continue. So let's look at the fetal presentations. So the ideal fetal presentation is the one of complete flexion. But we also have moderate flexion, then we have partial extension, and we have poor flexion, which is the face presentation. So the vertex presentation is the one that is ideal for vaginal delivery. Then the others, they need to be delivered by cesarean section. So when doing vaginal examination, I have already talked about the vertex presentation. You are likely to feel the posterior fontanelle. Then for face presentation, you are likely to feel the mouth of the baby. And if the baby is the active one, can end up sucking your mouth. Then for the breech, you are likely to feel the anal opening. And in most cases, because of the compressions, the fetus may end up doing poo-poo. So your gloved finger is likely to come out with uh, meconium. Then shoulder presentation, you are likely to feel the cornea. Position notation. So here we have examples. For the vertex presentation, it can be left or right. This is dependent on which side the posterior fontanelle has been felt. So the posterior fontanelle will determine the position where the baby is positioned. So if the posterior fontanelle is felt on the left side of the mother, then we say it is the position of the baby is left. If it's on the right, then it is on the right. Then shoulder presentation located at the right side of the mother posteriorly. So the shoulder presentation is likely to happen on the right side of the mother, whereas the vertex presentation is likely to happen on the left. Power, this is another component, remember. So power, here basically we are looking at the uterine contraction. So the uterine contraction is measured in form of the intensity that it gives. So here, when during labor, the assessment that is done is on increment, apex, and decrement. So when we talk about increment, the build up of the contractions as the contractions start mildly until they become strong or severe. Then apex, when they reach the maximum, which is the severe contractions. Then decrement, that now mostly happens during the second stage of labor, where they start decreasing until the mother delivers. Characteristics of uterine contraction, we have involuntary, intermittent, which involves discomfort. So of course the mother will feel pain, and this pain normally starts involuntarily. It is not stimulated unless in rare conditions where it can be stimulated, and it is intermittent. It can happen, it cools down, then it happens again. That is what we will refer to as intermittent. Uh, Intensity can be from mild, moderate to strong. Frequency, we consider the duration at which the mother rests before another contraction starts. Then secondary powers such as bearing down can be employed during the time when the mother is fully dilated. If the mother starts pushing when she is not fully dilated, then the cervix may end up becoming edematous. There are also potentials of tears, and there is likely to be bruising, and the mother is likely to become exhausted. Psyche, the psychological aspects of childbirth play a very important role. So, how the mother is prepared for her childbirth determines how she will react. So, when the mother is well prepared for the childbirth, she is likely to react positively. She will feel that yes, she can be able to make it, and indeed she will be able to make it. So, the maternal attitude and behavior during labor depends on many factors, and these factors include perception and meaning of childbirth, the readiness and preparation for childbirth, past experiences, coping skills, then cultural and social background, and presence of significant others and support, those who are giving her hands during this time. So this marks the end of our lecture for today. Thank you for being attentive to this. May God bless you.
Let me celebrate people back home let me congratulate at the celebrate what let's celebrate one year ago. Let's celebrate separately. If it's because you're not separating, then that's why you think things are going to be easy. I think you will reply smoothly. But if I separated, it's taking you ages. If I separated, if I separated, if I separated pornography.